Hi, this is Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium, and I'm excited today to be talking with Dr. Clint Flanagan, a family physician from Colorado who is living the dream. Dr. Flanagan, thanks for joining with us, and could you take a little time, give us some background on who you are, where you came from, and how you got to medical school and family medicine?
Well, thank you, Larry. I appreciate the opportunity. I'm Clint Flanagan. I'm the founder and CEO of NextEra Healthcare, which is a direct primary care company here in Colorado. And while I've been living with my wife here and my family in Colorado for over 15 years, I started off in Nebraska, where I was born and grew up in a small town. Made my way through the early days as a paper boy and then to the tasseling and a variety of jobs as most young kids have. And from high school went on to college in Nebraska. And in high school I had an experience where I was running track and ended up having to have a surgery on my knee. And so that was one of my first kind of big medical experiences that really made a mark on me. I definitely had interest there. So I joined, at the time it was called an Explorers Club, where we spent time volunteering at our local hospital. And through that experience, just kind of more and more excited and passionate about medicine. Went into college as a pre-med major in biology, spent time at Wesleyan University. And then after college, as much as I was pretty excited about med school and knew that I wanted to do that, I wanted to take a little bit of time off. So I did some HIV research at the University of Nebraska Medical Center and took some graduate courses. And through that pathway, figured out that as much as I liked the lab, I liked people a lot more than I liked mice. and so applied to medical school, got in at the University of Nebraska Medical Center. And, you know, through med school, I wasn't 100% sure what I wanted to do, but I was very interested in family medicine. I was interested in OB. I was also interested in emergency medicine. And what I liked through our rotations in medical school was the exposure that we got to small town rural medicine. That was very appealing to me. That's kind of what I grew up with. And seeing these docs work in these small communities where they really took care of their patients for years and had these robust relationships was something that really made an impression on me. And as I was moving through med school, I said, you know, I want to be a family medicine physician. And so I got down that pathway and then looked at different residency programs and really liked what I saw at a number of programs. But my number one choice was St. Mary's Family Medicine Residency Program out in Colorado, which was a community-based residency program. So it was a standalone residency program where there weren't any other residents, for example, surgery or OB residents. It was all family medicine residents. And plus it was a program that was placed in just a beautiful location on the western slope of Colorado. And I'll never forget when I was driving up for my interview looking at the parking lot, and it was a lot of forerunners with bike racks. And I figured, you know, these doctors, sure they work hard, but I think they play hard as well. And they play in the outdoors. So that was very attractive to me and had just great training under Dr. David West and Dr. Sherman Straw, Dr. Lance Reynoso and Peter Scheiberger out there in Grand Junction, just tremendous mentors. And that program, about 90+% or so of the residents that come out of that program go to smaller towns. So very well-trained physicians come out of the St. Mary's Family Residency Program and moved through that program and then went into a position at a large multi-specialty group on the Front Range of Colorado. And that large multi-specialty group, a bunch of great doctors, had been around for years, I think close to 50 different docs. And I was on a partnership track there, but really felt like I wanted to own my own clinic. And so through that process, ended up working for one of the largest providers of healthcare in the state of Colorado. And I did that for a few years, and again, kind of had this, gosh, I want to own my own clinic So I had the experience with a large system, had the experience with a multi-specialty group. Meanwhile, I was also working in emergency medicine and worked in many different ERs throughout Colorado, oftentimes rurally underserved emergency rooms. And so as we were moving down this pathway in fee-for-service medicine, having primary care experiences as a physician, but also having ER experiences, what I really saw a lot of was that the fact that it was hard to get back to that relationship that I had seen when I was a kid, where your family medicine doc did about everything for you. He took care of you. You know, there were no urgent cares. And what I saw a lot of was with patients coming into the emergency room to see me for things that their primary care provider, if they have one, should be taking care of. And so it was through that we looked around, and this is back in around 2009, surveyed the landscape, and we had hoped that there would be programs, for example, through the ACA, that would be creating solutions for patients, and we just didn't see a whole lot of solutions for primary care, so we created our own. And at the time, I didn't even know what direct primary care was. I just said, hey, we're going to want to take care of patients. We want to do it in a way where they pay a fixed monthly fee. We want to take care of employer groups. And again, fixed monthly fee. And for that monthly fee, you can come in and see your primary care doctor, your family medicine doc, anytime that you want, and there would never be a bill for that. So very early on in that pathway, we met some colleagues across the country that were doing this. And there were a few kind of scattered far and wide, and they called themselves direct primary care physicians. So what we were doing lined up pretty good with the DPC docs back then, and there were just a few in the country. And so we just started chugging along, and we did not close our fee-for-service practice. So this was at a time where we had a private fee-for-service primary care clinic with thousands of patients and a number of locations, and we felt at that time that it would be too risky for us on a number of fronts to close that practice. Plus, these were patients that we'd been taking care of for years. And, you know, it'd be hard to say, hey, we have a new model. Would you like to join it? And, oh, by the way, you know, we're going to shut down our fee-for-service model, and the doctor that you've had for a number of years is no longer going to be available to you in that fee-for-service world. So we said, rather than do that as we're a startup in a new model, let's hold on to that fee-for-service practice. And to this day, we still have that practice. It's called North Vista Medical Center. We have a number of locations. We have thousands of patients. So technically, we're a hybrid. So every day we see direct primary care patients and we see fee-for-service patients, and that's really worked out for us. And it's allowed for a lot of diversity and flexibility in our day-to-day schedule and the business that we do. And it's allowed for us to be continually reminded daily of why we do direct primary care, because we may go into one patient room and be taking care of them, and they're a NextEra healthcare patient, and in the next room may be a Medicare patient, or it may be a insurance-paying patient. So we get to see those challenges, be it prior auths or other, daily in our practice, and it serves as a continued reminder of why we do direct primary care. That being said, we aren't directly interested in growing our fee-for-service business, where all of our efforts for the most part are being focused is focusing on growing that direct primary care business. And recently we've had some data that's come out from last year to this year. So summer of last year to summer of this year, we've grown that direct primary care business now. The net growth is 260%. So we have thousands of direct primary care patients. About 85 to 90% of those patients are employer-based, so their employer pays for most, if not all, the direct primary care fee. And we're taking care of them, and now we're at a place where we have, I believe, 15 on-site or near-site clinics, and we have over 20 physicians and providers in our NextEra healthcare network. And so that network was something that I very early on felt was important. So rather than just be, 2 or 3 offices, I felt, gosh, let's have a network so we can target employer groups and have physicians that have their clinics in a number of places scattered throughout Colorado. And we're continually building on that pathway. So So that, Larry, is the long answer to your question. Try to put that in 2 minutes, but it was a big question. But we're having a lot of fun, and we're taking great care of patients, and it's definitely a model that, as we look at the fee-for-service model, this model, the direct primary care model, is a solution. Fee-for-service model is it's a model, but it's not really a solution for where we're at in America, and I think many people know that, and that's why they're looking for alternatives.
So, Dr. Flanagan, when we were speaking before we began this interview, you talked about kind of a holistic vision of what the Nextera allows you to do for patients, for the docs, and for the staff, and also for the employers. Do you want to speak a little bit about the how do you call it, the quintuple aim?
Yeah, as much as I'd like to take credit for that, I believe that's a Dr. Frank Morgan who coined that term here in the last year or so. So we were all familiar with the triple aim by the Institutes of Health, and then from the triple aim came the quadruple aim, which the next piece there on the fourth prong would be a model that physicians and providers can embrace and enjoy practicing in. And then the fifth piece of that essentially is geared towards employers. So the fifth prong would be that you as an employer, by having the direct primary care model, that will put you at an advantage compared to other employer groups that don't have a direct primary care model taking care of their employees. And so while we all want to obviously provide great health care, do so in an affordable way, and make an impact in our communities, what's very important in that model is that it be a model that doctors and providers enjoy working in. And we've had a lot of experience there over the years of models that aren't necessarily ones that we enjoy working in. And so on this pathway, the direct primary care model is a model that's actually created by doctors. So it's created by physicians on the front lines that understand the challenges and not only the challenges for their patients and access, but the challenges with the existing business model. So we've had a lot of fun as we're creating and making sure that what we're doing hopefully is simple, right? I think if you get too many people chiming in, it creates layers of complexity, and that's one of the beauties of direct primary care. It's a model that's a fixed monthly fee. Patients pay that membership, and they have access to their doctor. And when you allow that to flourish in a community, you're going to see healthier, happier patients and employees. And from an employer perspective, it starts to make a difference on total spend. It starts to make a difference on absenteeism and presenteeism in the workplace. Direct primary care can be used by employer groups as a retention tool and a hiring tool. And so fronting your company, whether you're a small company with 5 electricians or whether you're a large company with 4,000 employees and you're self-funded, fronting that plan or that benefit that you provide for your employees with direct primary care, I would argue is one of the best solutions out there that a owner or CFO or CHR could do for their company to make an impact in a way that's meaningful, that allows you to go from a place where you're just offering coverage in your benefits package to actually offering care. And I think there's a concern out there, and there's a bit of a fallacy that you're going to, by getting that insurance card, you're going to now have access and care. And in today's world, that is just typically not the case. And even if you're on a pretty robust plan, let's say a PPO plan, that doesn't have a deductible, you're still in a system where that primary care physician provider is seeing 20 to 30 patients a day. He or she is a busy, hurried doctor, and they're spending 7 to 10 minutes with a patient. They're not spending a half hour to an hour. So I would argue that, even when you're in a really robust benefit plan, PPO plan, think about your options and think about what you're getting for the dollar that you're spending, not only as an owner of a business, but as a patient. And I would argue that that dollar that you spend on direct primary care is likely to be the best ROI that you can get anywhere in the healthcare space.
So, Dr. Flanagan, I'm wondering, you're living your dream. And I'm wondering if you might speak to students and residents. I'm not sure they're hearing that family medicine is a pathway to living your dream in terms of caring for people and having a career that's exciting. Could you speak to the young folks?
Sure, and well, I like to think of myself as a young folk. My gray hair and puts me in a place where I guess I'm an older guy now. But what I would say, if I could do all this all over again, I would do almost the exact same thing. I would definitely choose family medicine, and even though there are the challenges of the fee-for-service model that I had to go through years ago, and still to this day, I like to say that those of us that have been around practicing for years kind of have some stripes on our shoulders, and we have some wounds and scars on our bodies from this business model that we're in. And what I want, students and residents to know is family medicine can be tremendously rewarding. You get to have a relationship with patients over years versus just, a one-time encounter. And I can speak to that as an ER doctor, because as an ER doc, if you have a relationship with your patients, that's a challenge. If they're coming in continually to see you in the ER, that's a problem. Versus in primary care, you want that, right? You want to have continued touches. You want to build trust in a relationship, and that is just a privilege to be a part of that with patients. And to have a business model that allows that to flourish, and direct primary care is that model, is pretty cool. And we've been doing this for years now. But I see those that are out there like Dr. Paul Thomas. He was a resident that I met when I was speaking at the Michigan Academy of Family Physicians annual conference, and he came up to me, I think he was a third year, saying that he wanted to do direct primary care right out of residency. So he had heard about this different business model in residency. He had researched it, and then did the necessary legwork to make himself comfortable enough to move forward. Right out of residency in Detroit, of all places. So I think downtown Detroit, in a place that needed some revitalization. And fast forward to today, he's doing a great job. He came out and spent about close to a half week or week with us here at Nextera Healthcare in Colorado, and I think he toured around to a few other direct primary cares. So if it's something you're interested in, research it. Start when you're a med student. If you're interested in family medicine, oftentimes with med school, you can have these rotations. Spend time with a family medicine provider or physician that is not within the halls of the university. Go out to a small town and spend time with that doctor, and you'll see that he takes care of about everything from an infant to, 86-year-old grandma that is in hospice. And that kind of relationship is something that you can see all throughout family medicine. And to have a business model that allows that to flourish is pretty cool. So if you're a med student thinking about family medicine, definitely explore, but just get outside of the confines of the university, number one. And number two, if you're a resident already doing family medicine, please understand that there are many opportunities because you are in high demand and you're in low supply. And while you could take a salaried position, which there are many these days at the bigger institutions, understand that you can also own your own clinic. You can have a private clinic that is yours. And so it's one of the beauties of family medicine. It gives you some options. And if I was a resident these days, I would for sure be looking at direct primary care. And the beauty for you now is there are many playbooks out there that you can look at. You don't have to create everything because there are playbooks versus back years ago, we actually had to kind of make up our own playbook. And so you can learn from those of us that are more experienced and have gone through taking a startup from 0 patients to thousands of patients and start to understand how you can really do this. And I don't know that there's been a DPC physician that I met that would not accept a student. So feel free to look at your zip code and see if there's a direct primary care doctor in your location. Feel free to go to dpcfrontier.com and look at the mapper there that Dr. Phil Eskew's put together, which is an excellent resource. Not only the mapper, but that whole website. Feel free to hit our website at nexterahealthcare.com And we're happy to have students rotate with us. In fact, we've got a student right now today. I'm seeing patients, and we've got a student rotating with us. So there's a lot of information out there now on direct primary care. And, if you're a person that wants to own their own clinic, has a little bit of business savvy to them, and is willing to take a little bit of risk, it's definitely worth it.
Dr. Flanagan, thanks so much for spending time with us today, and I look forward to continue working with you over time.
Well, I appreciate that, Larry, and thanks for being a champion for us, Larry, in the movement. I believe the FMEC held the first direct primary care conference down in St. Louis. I remember being at that, and those DPC conferences are kind of like a revival. There's so much energy at the conferences, and you were a pioneer and still are on that front, and we so appreciate all your efforts over the years. And that's another piece for students or residents. If you're interested and want to take a workshop or a conference, the American Academy of Family Physicians, FMEC, as well as a few other organizations, have 1 and 2 and 3 day conferences all across the country, and that way you can show up and do a bit of a deep dive into this model that not only is providing excellent care for patients in our communities, but it's a model that doctors enjoy working in.
Great. Thank you very much.
You're welcome, Larry.